Here we're talking about the Webster Technique. The Webster Technique is chiropractic specific. All of our providers in this office are certified. You will sometimes hear it as a way to flip a breech baby, but it is more about prepping for labor and delivery, really neutralizing the pelvis, relaxing all of the surrounding soft tissue, creating more mobility, and creating space for baby to potentially move head down, and then of course to also decrease pain and tension in the surrounding areas, only helping with labor and delivery and postpartum recovery. Here the doctor is working on the sacrotuberous ligament, a ligament that goes from the sits bone to the tailbone, really allowing it to relax, which is only going to help with low back pain, hip pain, tailbone pain, anything related to discomfort or tension on that backside. Here the doctor is assessing for the bony part of the pelvis, really looking at the tension on the one side versus the other, utilizing what is called a drop table to increase mobility on the tight high side. Sometimes a patient will be placed on their side if we need more mobility, but still being mindful to limit the amount of rotation or stretch in that area. Here the doctor is working on the iliopsoas muscle. This muscle is incredibly important for all things pelvic related and labor and delivery related. This muscle starts in the groin area, wraps around the backside, and attaches to every low back vertebrae. So this will decrease tension in your low back as well as the front pelvic side, and will also help tremendously in prep for labor and delivery, and then of course increasing mobility and movement on that front side. Here the doctor is working on the round ligament. It's a very expansive soft tissue area. Working on this area greatly impacts the pelvic tension on the front side, including the areas surrounding the pubic symphysis, all the way up to the diaphragm. So working on this area, lengthening it, really decreases a lot of tension on the front side. Here we are actually adjusting and mobilizing the tight pubic symphysis area. Doing this, again, creates really nice mobility in the entire pelvis.